In a patient who is complaining of premature ejaculation, there are a number of therapeutic options that can be offered to him. If the first one, which is the easiest in a way, is related to behavioral therapy, which has been reported to be efficient. It means that there are a number of behavioral techniques which help a number of patients to maintain a better control of the ejaculatory reflex and then to last longer during sexual intercourse. There are psychosexologists who are extremely well-trained physicians in this area. They may help the patient and the couple very much. Clearly, there are some men who are happy to undergo this type of treatment, others who just think that it will not work and they don't want to do it. If one goes to the medical treatment available, there are local anesthetics which are available worldwide in forms of a spray, in forms of creams. The advantage is that in some of the patients, they are extremely efficient. It is a local treatment. It is acting only there without the systemic side effects. But the other side of the coin is that anesthesia may be, first of all, transferred to the partner during intercourse, so sensation might be decreased significantly. And also, there are patients that, although they use massive doses of anesthetics, they don't see a good effect. The area of drug treatment is indeed extremely interesting because a few years ago, a new drug called dapoxetine has been officially approved and introduced in the market worldwide. Dapoxetine is a pill, so it is an oral drug which should be ingested more or less an hour prior to sexual intercourse, and it does interact with the metabolism of serotonin, the chemical neurotransmitter, which is controlling the reflex of ejaculation in our body. There have been many studies that have assessed something like 10,000 patients at least with dapoxetine compared to placebo, showing that the drug is able to improve significantly the time to ejaculation during sexual intercourse. The advantage of this drug is that it has to be taken on demand. So it is a pill which we would say has a very fast in and out effect. It goes in, it creates the effect quickly. After the effect is reached, it is leaving the organism, the body, very fast. So indeed, it is something that, in my opinion, should be offered to every single patient, and this is what I do in my clinics every day. There is another class of agents which is called PDE5 inhibitors, including sildenafil, tadalafil, vardenafil. All of them have showed two effects. Number one is that they improve erections. Number two, they do have some effects on ejaculation as well, although they have not been approved because there have not been specific studies in a sufficient number of patients on this specific area. In my office, quite often, I would combine the use of dapoxetine together with the use of a PDE5 inhibitor, and I do have brilliant results with my patients.